I'll just go round and see who's on the call. So Michelle.
Hi everybody, I'm the Greater Manchester lead for Speech, Language and Communication. So I'm jointly employed by the ICB and the Combined Authority. Thanks.
Hi Michelle. Lorraine.
Hello everybody, I'm Lorraine Donegan, I'm Head of Service of the Children's and Young People's Community Occupational Therapy Service with the MLCO, so Citywide Manchester Community Service.
Welcome Lorraine. Carol. Hiya Carol.
Hi Rachel, I'm Carol Palmer. I'm one of the speech and language therapy team leads for the clinic service in Oldham.
Lovely, nice to see you. Leanne.
Hi everyone, I'm Leanne Nicholson, so I manage the adult speech therapy teams at Manchester Foundation Trust.
Great, lovely to see you. Susan.
Hi, I'm Sue Jackson. I'm lead speech language therapist on the North Manchester Community Stroke team.
Lovely to see you, Sue. Lisa.
Hi everyone, I work for MLCO, Joint Head of Service for Children's Community Speech and Language Therapy.
Hi Lisa, and we've got another Lisa McAvoy.
Hello, I'm Lisa McAvoy. I'm one of the senior practitioners in TLCO. I'm standing in for our professional development lead.
Nice to see you. Joanne.
Hi, I'm Jo. I'm a senior occupational therapist with Central Manchester MLCO Hospital at Home team.
Nice to see you. Gemma.
Hi, I'm Gemma Harvey. I'm a trainee nursing associate at MFT.
Thanks for joining us, Gemma. Julie.
Hi, I'm Julie Lakovic. I'm here from Manchester Metropolitan and I have the lead for AHP programmes there, so both speech and hopefully in a few months OT.
Lovely, nice to see you. Michelle. Harrison. There she is.
Sorry, I just came from one meeting. I was trying to make my lunch while listening to you.
Sorry.
I'm Michelle Harrison. I'm here in two roles. I'm the Associate Clinical Fellow at Manchester Metropolitan University, developing the MSc Pre-Reg OT programme. I'm also Principal Occupational Therapist at Pennine Care Foundation Trust.
Lovely. So we've got a nice mix of people from OT, speech therapy, and universities and providers. I'll introduce myself in a sec, but I'll just sort of go through why we're here, and then if you decide that you've come to the wrong webinar, you can get off and do something else, but I'm pretty sure you're all in the right webinar. So I thought it'd be helpful to share with Greater Manchester colleagues the findings of a study that I've done over the last few months. I thought I'd be able to share with you my approach to carrying out the survey and the findings that I came across. I thought this would be helpful for us when we're looking at how we plan our workforce going forward and how we understand our supply from Greater Manchester and North West HEIs for these two professions. I'd like us to think about whether we can make the assumptions from this study. Do we need more information? And I'm going to show you about how this project intersects with some other projects that have happened recently. One's a Northwest OT student retention project, and another one is a Northwest maternity workforce student survey. And then if we have time at the end, I think we will. I think I'll talk for about half an hour, and then we'll have time to discuss at the end what next. If we should replicate the study, then how do we do that and widen it out to more AHPs in a sustainable way? Next slide, Sophie. Oh, and I'll put the chat on. We'll save questions to the end if possible, but if you do have anything that you have to mention urgently, I'll try and pay attention to the chat as well. So my name's Rachel Hemingway. I'm working at the moment, as it says behind me, as Greater Manchester AHP Workforce Lead. I'm on secondment for a year. My substantive role is as Assistant Director of Allied Health Professions in Bolton for the NHS Trust there. I'm a speech and language therapist myself. I got involved in this study sort of back in February. Northwest AHP workforce leads and our Northwest HEE leads were sort of discussing this question and the fact that we don't know the answer to the proportion of students that come from our HEIs that would also choose to work in our area. So I just started on secondment. I'd got some time, I was keen, and so I put my hand up and said I would lead on this on behalf of all these people. Next slide, thank you, Sophie. So in terms of context and rationale, why did we do this? I suppose the chief sort of driver is the long-term workforce plan, our sort of need to understand as employers and higher education institutes the workforce supply so that we can improve our workforce planning going forward in order to meet the health and social care needs of patients, children, families and communities. We have a process that some of you may have heard of, some of you may not have done, which is called METIP, which stands for Multi-Professional Education, Training and Investment Plan. And that's a sort of annual process where we work out sort of the numbers of students that we should have on each course going forward. Should we be increasing those? Should they stay the same? It's been a bit of a sort of, you know, lick a finger in the air and have a rough guess sort of process in the past. It improved, it became more scientific this year, but this information that we're looking at here as part of this project is a missing part of the puzzle, in that we don't know if we put a certain number of students onto a programme, what proportion of those students would choose to work in the area where they've studied. We work on a sort of Pareto principle, 80% sort of figure. We assume that about 80% would choose to work in the area, but as far as I know, that's not been formally tested in any profession. So that's that. We looked at OT and speech therapists because we train a lot of them in the Northwest. We and also because of the demand and supply concerns for both of these professions. They're both identified as at-risk professions nationally. I've aligned my findings, as I've already mentioned, with a couple of other studies that have been carried out recently. One, oh no, I don't think I have mentioned this, have I yet? One for OT students and their retention on programme, and one for maternity workforce and where they choose to work and why when they graduate. And as I've said, it is a collaborative approach with HEIs and across the Northwest. So next slide, please. The project aim is to pilot a survey method which will identify where final OT and SLT students studying in HEIs in the Northwest intend to work on graduating. And what we aim to achieve through this project was to identify the most effective method for surveying final year OT and SLT students and developing appropriate questions, through collaboration with our universities to survey the students and find out where they intend to work, to collect that quantitative and qualitative data about their preferred location and also their preferred caseload, service and area of work, and to look at also the actual location for those who had already gained employment and what has influenced those choices. And then to review the study method and results for the efficacy of the design and make recommendations for further study. So next slide, please. I surveyed the students between April and June 23 to understand their intentions. And I did this through a Microsoft Forms survey, which was sent to the universities who emailed it to all students in the form of a link. Initially, I'd planned to actually meet with students face-to-face or virtually and to share that sort of work across the Northwest so that some of the other AHP workforce leads would have met with students in their area. We've got OTs in Cumbria, UCLan, Salford and Liverpool. and we've got speech therapists in UCLan, Manchester Metropolitan and University of Manchester. They're the HEIs that we're working with. But because of the timing, I was interviewing people between April and June. The students at that time are writing their dissertation, they're on their final placement, they might be doing both of those things at once, and there isn't really any formal ways of getting the students together during those months. So that was really a learning for me, that timing didn't work brilliantly in terms of meeting the students. I did try it on a couple of occasions and just a couple turned up. So that wasn't going to be effective. That's why we ended up doing this survey link. I did manage to meet with a few students who were on placement in Bolton, and they were a mixture of OT and speech therapy students on a leadership placement. And that really helped me to test the questions and to find out that it was useful to ask those additional questions around, okay, this is where you choose to work, what has influenced that decision. So that's why I put a bit more detail in the survey around what's influenced your choices. Okay, next slide, thank you. And this is what we found out in terms of demographics. So I asked them where they are resident, and 73% of all the students surveyed from the Northwest. I'll give you the actual numbers that I surveyed in a minute, but 73% of those were from the Northwest, 9% were from overseas, and just out of interest, they were from Republic of Ireland, Trinidad and Tobago, St. Lucia, Saudi Arabia and USA. And then if we sort of took the international students out of the equation, then 80% of all our domestic students were from the Northwest. So that was sort of aligning with kind of some of our expectations, perhaps, initially. The speech therapy students, unfortunately, we didn't get any returns from UCLan speech therapy students. So they were all studying in Greater Manchester. They were all at Manchester Metropolitan or University of Manchester. And 56% of them were also from Greater Manchester. So I think, I trained 30 years ago, and in those days, more people travelled to university. I think we're seeing, and probably the universities have got, some data around this, more people staying closer to home. Next slide, thank you. Okay, so here's the top findings. In case you're short of time, you'll have heard this top findings if you're not able to stay for the whole session. So we got just a 29% response rate. It's okay, it's not brilliant. That amounted to 112 students out of a total of 387. And as I've said, 73% of those were from the Northwest. If we looked at those who didn't have a job lined up at this point when they were being surveyed, 86% of those said that they would choose the Northwest as their preferred place to work. 75% who already had a job lined up will be working in the Northwest. We're going to look at all these figures in a bit more detail through the session. Just 5%, I mean, we don't want any to not be working in their chosen career on graduation, but it was 5%, which amounted to 6 people. And it was 3 OTs and 3 speech therapists that were not intending to work in their chosen career. And what we found was both the positive and negative impacts of student placements were a significant factor in students' consideration of where to work, both in terms of location and area of specialism. We also found that private and voluntary sector employers are reported as an area that OTs and speech therapists would choose as a first job. Now, we've not done this study before, we don't have a previous baseline, but I did find the private and voluntary sector findings quite striking. Next slide, thank you. So, as I kind of already alluded to, I divided the people that I surveyed into 3 groups through the questions that they answered. Those not registering to practice, there wasn't any point in asking them further questions about where they would choose to work because they weren't intending to. So I just asked them a couple of specific questions at the end of the survey. We can compare these findings, are 5% of the total surveyed, with the recent Northwest Maternity Workforce Survey, which found 12% of the people surveyed were not choosing to work as a midwife in their first year after graduating. So a higher proportion, and on midwifery courses, they already have a higher sort of fallout rate as well from the course. So quite an issue with attrition there. So yeah, I will refer to some of their sort of findings and recommendations towards the end. So those who'd already got a job, 40% of the speech therapists had already got a job, 56% of the OTs, and that was 52 people. 54 of the 106 students were still looking for work at the time of the survey. Thank you. Next slide. Yeah, so those who haven't got a job yet, well, they have now, hopefully, but they didn't at this time. 71% of those occupational therapy students without a job would have chosen to stay in the Northwest. They showed a stronger preference for working in Lancashire and South Cumbria. Greater Manchester came out strongly as well. But if you combined their sort of first, second and third choices, then they were showing a preference for Lancs and South Cumbria. And I guess that's not surprising in terms of the demographics of where they're studying. Students who are in Cumbria and Preston, again, I'd like to learn more from the universities, but I'm guessing they're more likely to be studying close to home. But look at the figure for speech and language therapy. 97% of those without a job would choose to stay in the Northwest, and they showed a very strong preference for working in Greater Manchester. So if we look at the combined results, we've got 86% of those choosing to work in the Northwest. Next slide, please. And in terms of preferred sector, we've got a strong preference for acute and community, which is probably not surprising, but we're seeing OT who would choose to work in mental health and learning disability, and speech and language therapists looking also education roles. So I think not really any surprises there. That high figure though for OT who would prefer to choose the private or voluntary sector, and remember these are the students who don't yet have a job at time of being surveyed. I think the other thing that we should pay attention to is the fact that nobody has said that they would prefer to work in social care, local authority or primary care. We're not currently growing a workforce that has an active interest in working in those sectors, according to this survey. Next slide, thank you. If we look at the actual destination, it's a bit hard to see, so I'll talk it through with you. As I've told you, the speech language therapist without a job had got a strong preference to work in Greater Manchester in the Northwest, but actually they're finding it harder to find work. And so you can see the grey is the speech and language therapists. They're working further afield, so they're going to places such as Hull, Lincoln, Nottinghamshire, Staffordshire, Wales. The OTs are more sort of focused in the Northwest. We've got the majority who found work in Manchester, followed up by Salford, and then Blackpool is recruiting quite well as well. Only one of the overseas students is looking to work overseas for their first job. Next slide. This is the actual care sector of those with jobs. So again, the majority in the acute and community trusts, and we're seeing that sort of split for OT and speech therapy into the mental health trusts and education roles. We have got one or two OTs who are, I think it was one, working in social care. And again, you can see those 5 students going in the private and voluntary sector, both speech therapists and OTs. That amounts to 10% of those surveyed. Okay, next slide. What influenced your choice of care sector? And these are for the people who have got jobs. And we see the strong combined choice coming through of positive student experience at 64% when I sort of combined all the findings. But it really does stand out for speech therapists that has made a big difference to them. At 48% for OTs. OTs are also perhaps, according to this, more likely to go into an area of work that they would have chosen to go when they first joined their course, and SLTs are perhaps more influenced by looking at job availability. And I did pick up right through the survey that sort of anxiety from speech therapy around where they're going to find work. It came through in some of the commentary as well. I think that's probably all from that slide. We can come back to it if you've got any questions about it afterwards. So next slide. So I've just got a little bit of the free text here. The first comment, prior to embarking the course, I wanted to pursue a career within the local authority. I tried to secure a final elective placement in this setting, but all attempts were unsuccessful. All of my NHS-based placements have been positive, and this has made me readdress my career pathway. Just let Rachel in. And then sort of conversely, negative placement experience in the NHS has influenced my considerations of work elsewhere and in alternative sectors such as education and business. We had another student who mentioned that she'd gained employment with a charity where she was able to negotiate funding for career development more easily and term time only contract. So I think, you know, some of the themes that are coming through there we need to really pay attention to. Next slide. I've pulled this slide actually from the work that Annalise Schofield has done. She, as part of this reducing pre-registration attrition and improving retention work that's been done across the Northwest. And this has come from occupational therapy. It ties in with perhaps some things I'm going to sort of tell you afterwards, but she found that that these were the things that OTs were looking for from their educators, and these were the things that again could influence them to want to stay on the course, because she was looking at the risk of OTs leaving the course before they graduate. So I thought that was quite a helpful sort of thing to add into the mix here. Next slide, thank you. So this was my final question. Oh no, it wasn't. It was my second to final question. What would be your dream first job? I felt that OTs were quite, you know, did let their imaginations run a little bit wild here. And so we got exciting things such as equine therapy, perinatal and mental health, working with babies and toddlers, driving assessor. But things like the items in bold were items that were mentioned by several people, and the items that are in italics were also mentioned by speech and language therapy as well. So as well as the sort of care settings and areas of specialism, I think it's worth sort of really paying attention to those additional factors that people were looking for and that came through in terms of a dream job. So a varied rotation is generally available for Band 5 OTs, but perhaps not term time only contracts. I heard a few times here and also in conversations that I had separately around being part of a cohesive team, having a sense of belonging in the team that you're with as being a real priority, and that issue of intervention rather than just assessment as part of your role. Can I have the next slide? Thank you. So we can see some similar things here, perhaps broader care settings, but all in line with sort of the core work, I suppose, of a speech language therapist. We had a lot of people specifying that they'd be looking for a paediatric post. We also had a lot of people specifying an adult post. So I saw a variety there. We heard rotation being mentioned a few times, or mixed adult and paediatric posts. I think this is really something worth thinking about, how we can do this, because it's something that used to happen, and it's very rare now. And I think it really helps our students who haven't perhaps decided finally which area to work in, to get a taste of both in their first job. Having time for admin, working part-time, and being supported to get competencies and learn are all fair requests, I would suggest. Not particularly a dream job. That should be a standard job, shouldn't it? Okay, next slide. And then I asked what they would be looking for to help them to prepare for their first role. And I did a thematic analysis for OT and speech therapy. And again, the bold items were mentioned several times, and those in italics were mentioned by both OT and speech therapy. And we saw similar sort of requests for both professions. And they also aligned with findings from the OT repair project that I've already mentioned. They're looking for support with employment skills, job applications and interviews. They're looking for links with trusts, perhaps through open days, careers days, but also linking with current band 5s in terms of work shadowing and understanding what the band 5 role looks like. So going from the sort of theory to the reality of a band 5 role. They were looking for, OT specifically, were looking for more time on the job, really, more placement hours, or optional additional hours. Yeah, that did come through, that they felt the need for more time in the workplace. And that also came through from Annalie's study, where they were saying, so one of her final year students said, we wanted more core skills. There's still lots of things we haven't done or heard of, and it's quite scary thinking we're going to be band 5s. And the next slide, thank you. So again, you'll see some sort of similar themes coming through: information about band 5 roles, talks from band 5s, learning about the Northwest employers, mock interviews, practicing applications and interviews, more practicing of assessments, more teaching about adults and dysphagia, shadowing band 5 opportunities, more placement hours was mentioned, placement support specifically for ethnic students was mentioned, and support with confidence due to the lack of job opportunities. Yeah, I said this did come through as a bit of a theme, that there was that worry that they weren't going to get a job, and a bit of support, mentorship around that, perhaps. Looking for a kind team, time to settle into the role, a clear induction, and information about research and alternative roles. Next slide, thank you. So this is my evaluation, but I'd really value your thoughts, comments on this as well. I felt like the survey method worked well, but not the timing. So I would seek to do a similar survey earlier on in the final year, around now, ideally. I don't know whether those people that are on the call from HEIs, find that that students are already being asked too much around this time, but this is when I would like to repeat it. And that would then simplify the questions, because you wouldn't have those two sort of data sets of those who've already got a job and those who haven't. You just put everybody all together in terms of what are you looking for and what influences that. And so you'd simplify the questions. And that's actually what my maternity workforce colleague did. She asked a really simplified sort of question set that was easier to gather and summarize what she'd learned. So yeah, the collaboration between the HEIs and our AHP workforce leads was great. You know, I was really supported by our colleagues in the universities. I liked the fact, and I found it helpful, that we got both the quantitative and qualitative data. And I think yeah, that it has enabled us to make recommendations for further study. I would probably, in terms of getting a bigger data sample, consider using social media, which again my maternity workforce colleague did, to share the survey, and use the PEFs as well. So just using as many routes as possible to get the survey out to students. Next slide, thank you. Recommendations. So these are the things that I think we can sort of draw from the study, but again, I really value your comments. Timely recruitment of Band 5s from our local HEIs could secure a workforce keen to stay in the area. This could be maximised by a system-wide approach for AHP professions. So, you know, you could just imagine having a sort of marketplace where you're trusted there, where they are talking to students sort of early on around the opportunities that are coming up. They could, at that sort of event, you know, practice some career skills, practice some interview skills. They could yeah, that would be a great way to secure people working in an area where they would actually choose to work, from the information we've gathered here. Yeah, so that could coordinate with providing sessions on employment skills, creating links between students and employers. At an ICB level, so at Greater Manchester level and across the Northwest, I think it's really useful for us to learn and talk more with our HEIs about their specific university and AHP programme demographics. That it's going to vary a lot, I think, from course to course and from university to university in terms of the age profile, the ethnicity, the diversity, and that will then have an impact on where people are choosing to work. Employers, I think, from this study should aim to have diverse roles at Band 5, including part-time posts and some choice where possible regarding rotation or non-rotation. I think, you know, in this study and in other studies, we've heard from some people who would just find it too overwhelming too soon to rotate every 6 months and need more time to establish themselves with a team and a service. I think if we're particularly thinking about inclusion and belonging for our colleagues who are neurodiverse, for example. Continue to focus on this, I think, is probably the key recommendation, and finding how to deliver good quality placements which inspire students to work in that location and care sector. And I would recommend that we repeat the survey to all AHP professions early in the final year, simplify the survey design and promote through social media. Next slide, please. And actually, I was just going to say, with those recommendations, they really do align again with what our midwifery sort of colleagues recommended. They recommended that organisations and HEIs collaborate to develop transition support for third-year students, including preceptorship, career conversations and recruitment advice. And that on student placement, the sort of clinical educators have conversations with the students around, you know, a bit of a sort of temperature check around how they're feeling about going into their chosen career, to see whether, you know, any support can be provided to help them to stick with it if they're feeling a bit wobbly. And again, they were recommending flexibility and work-life balance with new roles. So here we go. Next steps, doing what I'm doing here. I'm, you know, cascading this at Greater Manchester level. My colleagues will be doing the same in Lancs and South Cumbria and Cheshire and Merseyside. And that at each sort of system level, we need to review recommendations, create a plan, and that we consider again at regional and system level whether and how to repeat and extend the survey. Next slide. Thank you for listening. I really do value your questions and comments and insights. Do you think that I'm right in the assumptions that I've made and the recommendations that I've made? Do we need more information? Do you think that there's a case for some trailblazers in terms of some of the recommendations, creating links with students and creating you know, those opportunities for career conversations and practicing interview techniques, etc. Michelle.
Thanks. That was really, really interesting, Rachel. And actually, I was really interested also to hear that many of the findings that you came across, certainly in comments from the students, are exactly the same things that have echoed in the speech and language workforce work that we've been doing in Greater Manchester. So that's you know, that feels like it's authentic because we're getting the same things each time. And one question I would like to ask is about gender. And did you do anything that looked at the gender of the students between the two workforces, and if there were any differences in that?
No, really nice thing to think about though, isn't it? I didn't ask any sort of diversity data as part of this. I didn't have a strong rationale for collecting that, but yeah, I think that would be really interesting. Do you have findings around that, Michelle?
Well, in terms of the children's workforce, when we're talking about our equality data, it seems that for children's speech and language, actually ethnicity is reasonably well represented. What is really not well represented is gender. So in terms of representing our populations, it's a 5-to-1 ratio between boys and girls, but I think it's 98% of our workforce is female. So gender is a huge issue for children's speech and language therapy. And I think actually it's an issue for all children's therapy services, not just speech and language.
Thanks, Michelle. Lorraine.
Yes, I agree with Michelle. Gender is a massive issue. Thank you, Rachel. That was really, really interesting. I would be very keen to kind of, you know, from some of the findings that you had from your study about, you know, OTs. I'm going to talk about OT because that's my profession, about wanting to be more skilled and having more placement opportunities. Now, that isn't always possible. However, doing that piece of work around band fives, working band fives to go into university and maybe do like a, you know, this is a day in the life of a band five. And for me, my particular area, which is paediatrics, which is very specialised, and it isn't covered in depth at university. It's kind of, maybe we're lucky if we get a day. That's the kind of feedback I'm getting from the OT students that we have coming out. Obviously, they've got a lot to cover, haven't they, in those 3 years, but just to kind of raise awareness. And certainly talking about our social service colleagues, you know, often it's the fact that they've never had the opportunity to be on placement, or they don't really understand the role. I'm sure they would like to do something similar, as in the day in the life. What would a day in the life be of a social? I think that would be a brilliant piece of work, because you're hearing it from students who are just fresh out. You know, it's you know, that real life experience.
Yeah. Fantastic idea. I've written it down, and I'll make sure that we pick up conversations with HEI colleagues around this. Lisa McAvoy.
Hi. It was just a couple of things really. So firstly, it's quite exciting to hear about the things that we can do to encourage students into the workforce, because they're fairly simple things to do. You know, shadowing band fives, having better links with them, having an open days for the trust and things like that. And yeah, it's quite exciting. We can do all of those things.
Great.
But there's also the big challenge, isn't there, to do with the increased number of placements, because with the increased number of placements that's being required, we're getting suggested we have 2-to-1 students, leadership placements, a time where students aren't with their educator more and more. Yet that's not what the students are saying that they're needing. They're saying that they're needing extra hours, they're needing more clinical time, more core skills, and they're saying the opposite to actually what we're required to do in order to fulfill the number of placements that are needed.
It's not necessarily the opposite, as long as those placements are still good quality. So you can have 2-to-1 and you can still have plenty of time, and you can do peer placement, you can do group placements, leadership, and it's all. So the people that that I've seen on leadership placements, for example, are really getting to know the organization, they're getting to know the leadership structure. And I did hear from students on leadership placement, they actually gain that sense of belonging being there. So I don't think we can necessarily make the assumption that pressure on placements, which I do not deny, is contradictory to what the students are saying. Maybe. I don't know. Jo Yates.
Hiya. Yeah, I just wanted to sort of say about, you said you were a bit surprised with the OTs going a lot into charity work and things, but I only graduated 5 years ago, and I was at University of Cumbria, and I know that we had a whole module on role emerging placements and where you haven't got OT at the moment and where you could find OT. And I know Salford are big on that as well. So for me as an OT, that's not a shock.
Okay.
We're actively encouraged to look for role emerging rather than going straight into like NHS and social, where OT already is proliferant. So and I think it's a good thing, but then I do think we need to staff our NHS.
It's that, isn't it? Yeah, it's not a bad thing, but yeah, how are we managing that supply? Yeah. Thank you, Jo, that's really useful. Leanne, sorry, I think I missed you before.
That's okay, I'll forgive you. I don't know if you did anyway. Thank you, that was really interesting. I'm a speech therapist. I've become quite fascinated in our changing kind of workforce and profession and the pressures that are coming with that. I just wanted to mention 2 things, if that's okay. I did a survey a while back on Twitter around looking at sort of, again, first posts and split posts versus rotation posts versus static posts, and got some really good response rates to that.
Great.
So I guess I was just saying, you mentioned other ways of getting the survey out there. That was really positive for the one that we did.
Right.
We got about 150 responses, so that was really great. My question, though, I suppose, and I don't know if you know or if anyone else knows, I'm really intrigued by these high number of students that want to stay in Greater Manchester, because we have, we're a big trust. We have the adult speech therapy CSS teams, acute teams, but we don't have that many band 5 posts all of the time. So I'm just wondering if you, Rachel, or anyone on the call knows how many, typically in a year, how many band 5 posts are there in the Northwest per profession? Because I feel like we're probably one of the biggest teams, if you like. We've got sort of 60 speech therapists, and there's all these wonderful students wanting to come and work here, but we've only got maybe 5 or 6 posts. It'd be really interesting to see what the turnovers of that are. I don't know if anyone knows.
That's a really good question, and it is again a key piece of data that would be really helpful, and I definitely don't have that information. I don't know, Julie, you won't have that, will you? I don't think.
No, I don't, but I do think it leads into some of the comments that you were seeing, particularly around the speech and language therapists worrying about whether they will get a job. They know they will get a job, but they won't necessarily get a job exactly where they want a job. And I think that's the pressure. So they know, particularly if they want to work with an adult caseload, they know there are fewer opportunities. And if you combine that with wanting to work in GM, you start to really narrow down. So they feel that sense of competition. And I guess that's against a narrative at the moment of it's a shortage profession, there's lots of jobs out there, but when you're looking for one very specific job, it can feel that I ought to be able to walk into a job, but actually the opportunities aren't coming up. And again, there's a timing thing about when opportunities start to be advertised. And I think because we're seeing band 6 posts vacant, teams can't just take on loads of band 5s and hope for the best. There has to be that structure. So I think actually what's happening, what students are picking up, is quite nuanced and complex in speech and language therapy. I can't obviously speak for OT. So I think there's multiple factors coming together there.
Yeah. Thank you. I'll just I have a couple of thoughts, but I'll just bring in these other hands because we're getting towards the end of the session. Michelle, lots to think of for your course in at Manchester Metropolitan.
Yeah, and also I suppose I am thinking about this with my two hats on. So addressing the band 5 issue, I've just been doing some work mapping all the OTs in Pennine, and we've had a lot of band 5 posts converted to band 6 posts. So we have like the majority of our OTs are band 6s. So there's work that needs to be done, but also you have to take into account that although I'm the principal OT, all the OTs are managed within their teams on the wards or in the community. So I don't have any influence. I can influence, but do you know what I mean? I'm not directly line managing the people who make those decisions about where OTs are. So there's a lot of work to be done. The other thing I wanted to talk about was students wanting more placement hours, because I think there's something about expectation versus reality, isn't there? So I went to a Northwest webinar a few weeks ago where somebody was talking about how to support students when they first started and talking about what their expectations were of the course. And I think there's something about how we support students. I've done, Julie knows, obviously, because I work with Julie, but I've worked in education in Scotland and worked a lot around placement. And there is something about what is the reality, like I said, the reality of balancing the demands for our colleagues in practice and the demands the students have. And like you say, I think the important bit is that transition bit. And I think absolutely that's the right thing. I just had one more question for you, which was, did you ask students where they came from? So did you understand if they were already from the Northwest or had they moved into the Northwest? Just so you could understand if people were remaining or were come in and were choosing to stay after the training. So that's my 3 things.
Thank you, Michelle. Yes, we had I think I said 80% of the OTs and speech therapists that were surveyed were domestic students from 80% of the domestic students were from the Northwest. Yeah, that's the answer to that one. I think that and that was one of the things I was going to mention. It's that fact that we're converting into band 6. We need that level of responsibility, we need that level of specialism, and so people progress to band 6 quite quickly. Now Bev Harden at a session that she did recently said actually that's okay, we need to be working with quite a push through to band 6, a well supported band 6 sort of workforce, because then we create the gaps at a band 5. But what we're doing perhaps is a bit different to that. We're turning a band 5 post into a band 6. I know that happens in OT and speech therapy, and like you say, it's how we influence what happens with those roles and how to hang on to that band 5 workforce to keep people coming in, keep the supply going, supply routes. Lorraine.
One of my concerns is that because our student allocation has been taken over by the PEF, we are finding it very difficult to accept elective students. And so in paediatrics, because it's quite specialised, they're the students that you really want because they're your future workforce, because they've identified that's the area they want to work in. We've got an OT apprentice, so we're expected to, on top of our normal allocation, you know, provide opportunities for other OT apprentices within the trust, and that's not taken into consideration our numbers. So unfortunately, for the first time ever, we've had to turn away an elective student who wants to be a paediatric OT, and it's not right, because often we have students here who have absolutely no interest in paediatrics. And I just think
difficult, yeah.
We're with the PEFs coordinating our placements, we're losing that connection with the HEIs, that we can have these conversations, because you know I've got vacancies within this team, and that placement, that person who's on placement could have gone straight into one, you know. It's a massive
We've got a
concern.
lot of people agreeing with you around that, Lorraine. Lots of nods, etc. I wonder, so one of the things that came from the repair project was around creating those sort of 0 hours therapy assistant roles in the area. It might, I know some of these teams are so small that you don't have any flex in your budget or your staffing to do that, but to create those sort of staffed roles for students to fill, even if it's just a few hours in a holiday or whatever, then that gives them an additional opportunity, or some voluntary hours. But yeah, I hear what you're saying around some of those conflicts there that are going on. Julie.
Thank you. I'm going to say something very controversial now, but really it's just sharing something that I hear increasingly from students, and that is in speech and language therapy, because we've been working really hard to give our students that AHP identity and part of a bigger workforce. They now realise that speech and language therapy students get half the placement hours of their other AHP colleagues. So speech therapists doing 525 hours compared to the 1,000 hours in the other professions, and they don't understand why. And it's actually quite hard to justify why, because it's such a big difference. Now, clearly, the idea that we could suddenly have capacity for all our students to do 1,000 hours, or that's really what's needed, there may be some middle ground. But I do think, you know, that the graduates and trainees we've got now haven't had the same opportunities. So when they're saying we need more confidence and we need safe people, these are the very students that didn't get the work experience in their late teens because of COVID. They were in lockdown. They didn't have those normal public place interactions where they honed their confidence in dealing with people. So I think as practice, people in clinical practice are seeing that general less confidence about how the world works, and you know, all of that, when you couple it with fewer hours, starts to potentially make a difference. So we are, as an HEI, trying to look at how we develop more skills sessions, how we give students more opportunities. We hosted actually a really successful AHP employability fair last Friday with, I'm sure, representatives from many of your trusts, where we had lots of AHPs in, but then panel sessions for students to ask these questions about jobs. So I think we're trying to work very much with you, because it's one and the same outcome, isn't it? It's developing our professions. But I do think there's been a change since COVID, and I do think speech and language therapy students do feel that lack of skills-based work, and we need to address that to develop their confidence.
Thank you. I think, it was coming through actually quite strongly from the OTs though, and I think that's, and again, that was reiterated by other studies as well. Leanne.
Sorry, I know we're running out of time. I just wanted to follow on, Julie, from what you were saying. We're seeing it with the new band 5s as well. So when they come into post, they need so much more than the band 5s who came into post 5 years ago. So in terms of, it's not necessarily clinical skills, it's basic interactions. It's how to interact with someone that's maybe elderly with a bit of a hearing impairment, and they sort of, there's a panic, or it's those sort of professional interactions I think we're seeing all the way through. So yeah, I think it's probably one for all of us to pick up as well. Yeah, I just wanted to share that.
Thanks, Leanne. And Michelle's nodding. I think that's something you're hearing as well, isn't it? And Michelle, you'll need to do one of these sessions with your work.
Happy to.
Because we'll all want to hear that as well. I really appreciate your engagement. I hope you found it helpful. I don't think I've missed anything from the chat. Is there anything that anyone has written in the chat that we've not picked up on? Thanks. You've really helped me in reflecting on this project. We're lucky in Greater Manchester to have excellent links with likes of Julie at MMU and University of Manchester colleagues, and Salford and Bolton. We're a strongly knit community, I think, in terms of in AHPs. So we will work together on some of these findings and think our way through some of the next steps. If any of you here on the call are interested in picking up one of the recommendations, being a bit of a trailblazer, then get in touch. But thank you so much for your time. Have a good rest of the day.
Thank you. Thanks, Rachel.
Thank you, Rachel.
Thank you.
Thank you.
Bye.
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 Thanks, Sophie.